Hello, good morning, one and all. This is Reshma, Senior Nursing Officer. Welcome to a wonderful session of Healthcare Hub on my channel. So, today morning, this is first time morning session I'm conducting, and welcome one and all. So, those who are live, welcome to Healthcare Hub. So, my channel ki first time vachinatlaite just like my channel, share my channel, and subscribe my channel. So, today we are going to discuss about the immunization and biomedical waste topic, and let me share in my nursing groups and also in my WhatsApp group, and the description for joining and the class notes will be available in my Telegram channel. That Telegram channel link is available in my description box. Okay, let me share. Hope the audio and video everything is clear. Sites and more. Let me share. So how many of them come live? Okay. So just 1 second. Okay. Well, Morgan, good morning. So today we are going to discuss regarding this immunization, and as you know, the immunization has been categorized into, now I have means I have differentiated into three more categories. That is, so today's topic will be regarding this. So these are the slides which we will be discussing today. So these are the slides which we will be discussing today. So this is the summary of the slides which we will be going through today. So today's session will be both in English, Hindi, as well as in Telugu, not in Hindi, but English and as well as in Telugu. Okay. So this is about today's class. So immunization and also biomedical waste. 1 second. Okay. Well, Murugan, is the audio and video everything clear? So immunization for pregnant women and immunization for infant from birth to infant, and the third category is for children 1 to 16 years. Okay, please take in English today, ma'am. This is important topic. Okay, sure, Morgan. I will take in English. Okay. So coming to the pregnant women, the immunization is like, so in pregnant women we have three means TT1 and TT2. If you take the tetanus toxoid which is given during the early in pregnancy, and it is how much it is given, 0.5 ml in the intramuscular region, and that too where it is given in the upper arm region. In the upper arm region, this particular injection is given. And TT2 is given 4 weeks after the. So the time interval is around 4 weeks. So 4 weeks gap ichin tarvata we will get the TT2 dose. Okay, so this is also the same 0.5 ml and intramuscular it is given in the upper arm. Okay, and if you look at the TT booster dose is given if last two TT doses is given in the last 3 years, then with only TT booster dose will be given. Not again 2 doses will not be given. At least 3 years of gap. For example, this year I have received, again within 3 years again if there are chances of this conceiving, then I will be getting only TT booster dose 1. Okay, only 1 dose will be given, and this is also the same thing. So the dose is same, that is 0.5 ml. Okay, and the route is IM route and the site is upper arm. So pregnant women will be getting almost 2 doses, TT1 and TT2, and almost 4 weeks gap will be there, and there will be booster dose is given when there is 3 years of gap. Okay, so this is about the pregnant women dose. Then birth to 1 year. So if you look at the birth to 1 year, we have categorized into here, see, BCG, hepatitis, OPV, OPV 1, 2. So this is the birth dose. So birth dose, this is here. Okay. Then if you look at the, again it is categorized into 6, 10, 14 weeks. Then this is 9 months to 12 months. So like that we have categorized into 3 for 1 year child. From birth to 1 year child, any categories ఉన్నాయి ఇక్కడ? BCG, hepatitis B, OPV, ఇలా ఇదొకటి. నెక్స్ట్ మనకి OPV, ఇది IPV, నెక్స్ట్ ఇది 9 months. సో ఆల్మోస్ట్ మనం 3 categories గా చేసుకున్నాం. So BCG is given at birth. It is given at birth till 1 year and the dose is 0.1 ml and it is given intradermal route around in 15 degrees angle lo istaru. Usually the dose is given at left upper arm. Okay, then we have hepatitis B. It is given within 24 hours of birth and 0.5 ml is given, and it is given through the intramuscular route. Whether the screen is visible to all of you? Okay. Good morning, Lokshan Vitriram. Okay. Okay. From hepatitis birth is given 0.5 ml. It is IM route in the thigh region. Then oral polio vaccine, oral polio drops, and it is given at birth for within 15 days, 2 drops. This is oral route. So if you see this lip sign, that is oral route, and the site is also the oral. So at birth, almost we will be giving 3. At birth, we will be giving 3. One is oral and one is intradermal, BCG. Okay, and the other is like on the anterolateral aspect of the thigh. Anterolateral aspect of thigh. In the oral route, we will be giving this OPV, and the intradermal route, we will be giving this BCG. Then here on the thigh, we will be giving the hepatitis B. So birthday gift like 3 things will be given: oral polio vaccine, BCG, and hepatitis. This is given through IM route, and this is given through intradermal route, and this is given through oral route. So this is given at birth. So these things are given at birth. Then the next one is given at 6, 10 and 14 weeks. 6, 10 and 14 weeks at birth. Then 6, 10, 14 weeks will be giving So at 6, 10 and 14 weeks, the baby will receive oral polio vaccine, pentavalent, rota and IPV. Okay, oral polio, pentavalent, rota and IPV. Oral polio, pentavalent, rota and IPV. Okay, this is inactivated polio vaccine we will be giving. Oral polio we will be giving through the oral route. Oral polio will be giving through the oral route. Pentavalent is a combination of 5 vaccines. That is what DPT, manaki Hib, hepatitis. Okay, that is diphtheria, pertussis, tetanus, Haemophilus influenza B and hepatitis B. So if it is OPV, this is OPV, 0 dose will be giving at birth, and here OPV1. Okay, OPV1 is given at 6th week, 10th week and 14 weeks. So understood? So this is the differentiation here. So at birth this is the dose, and at 6 weeks, 10 weeks and 14 weeks we will be giving OPV1, pentavalent 1, and rota vaccine is mainly given for to prevent diarrhea in children. Then this is inactivated polio vaccine. Inactivated polio vaccine ante, see, the vaccines will be inactivated. There will not be live vaccines, only inactivated vaccines will be given through oral route, and this will produce immunity in the body. Okay. Okay, Lokshan with Ram. Okay, your name is Deepika. Okay, welcome Deepika. Then around 9 months. So this is here we can see the 9 months dose. So during 9 to 12 months we will be giving this measles, Japanese encephalitis and vitamin A. So 9 to 12 months we will be giving measles, Japanese encephalitis and vitamin A. And vitamin A will be given. Okay, so this is the 9 to 12 months dose. If you look at the measles, it is given through the subcutaneous route, and the dose is 0.5 ml. Subcutaneous route it is given, and it is given in the right upper arm. BCG is given in the left upper arm, whereas this measles is given in the right upper arm. Usually Japanese encephalitis is given in the endemic affected areas. Means ఏ ఏరియాస్లో అయితే ఈ జాపనీస్ ఎన్కెఫలైటిస్ అనేది ఎక్కువ ఉందో ఆ ఏరియాస్లో మాత్రం ముందు ఇస్తున్నారు, కానీ ఇప్పుడు అలా కాదు. ఇన్ మోస్ట్ ఆఫ్ ద వ్యాక్సినేషన్ సెంటర్స్ దిస్ ఈజ్ అవైలబుల్. సో జాపనీస్ ఎన్కెఫలైటిస్ ఈజ్ గివెన్. దిస్ ఈజ్ ఆల్సో గివెన్ ఎట్ ద time of 9 to 12 months around 0.5 ml subcutaneous route, that is in 45 degrees angle it is given. It is given in the left upper arm. Okay, measles in the right and this is in the left. Okay, so measles is given in the right side, and JE vaccine is given in the left side. So both is given through subcutaneous route. Okay, then if you look at the vitamin A, it is given in the, so it is started in the 9th month లో స్టార్ట్ చేస్తారు. 9th month లో స్టార్ట్ చేసిన తర్వాత అరౌండ్ 1 ml ఇస్తారు. సో 1 ml ఇచ్చినప్పుడు అరౌండ్ 1 lakh ఇంటర్నేషనల్ యూనిట్స్ అనేది ఇస్తారు. ఇచ్చిన తర్వాత ఇది మెయిన్లీ గివెన్ త్రూ ద ఓరల్ రూట్, అండ్ ఇట్ ఈస్ గివెన్ ఎవ్రీ 6 months ఫ్రమ్ దట్ టైమ్. ఓకే, ఇట్ ఈస్ గివెన్ ఎవ్రీ 6 months ఫ్రమ్ దట్ టైమ్. సో 1 lakh international units it is given. So it is started from the 9th month, and the frequency is every 6 months it is given. Usually the initial dose will be like 2 lakh international units, then later on it will be given like 1 lakh international units, and every 6 months will be given till the child is 5 years of age. So totally how many doses will be given from 9 months to 5 years? Almost 9 doses of vitamin A will be given. This is given through the oral route, and rest of the measles and Japanese encephalitis is given through the subcutaneous route, one on the right arm and one on the left arm. So clear with this vaccines and all? So this is how it looks like when we start dividing, means when we want to show it, this is how the vaccine looks like. If you want to say it in very short way, అంటే ఈజీగా గుర్తు పెట్టుకోవాలి అంటే ప్రెగ్నెంట్ ఉమెన్కి మనం 2 times టీటీ ఇస్తాం. ప్రెగ్నెంట్ ఉమెన్ విల్ గెట్ 2 times టీటీ, అండ్ ఎట్ బర్త్ విల్ బి గివింగ్ BOH or HBO. HBO channel, you know, home box office. This is a English movies channel. Okay, so HBO is, that is nothing but hepatitis, BCG and oral polio is given at birth. Then in 6, 10 and 14 weeks we will be giving OP pen IP rota PCV. Just say it 4 times, 5 times. OP pen IP rota PCV. OP pen IP rota PCV. So this include oral polio vaccine, pentavalent and inactivated polio vaccine, rota vaccine and pneumococcal vaccine is given at 6 to 10. Then at 9 months, 9 months we will be giving what and all? MR, that is measles, rubella, Japanese encephalitis, vitamin A, pneumococcal vaccine and booster dose. Then again at 16 to 24 months, again it is a booster. Booster dose will be like 1. Zero dose means that is a zero dose which is given at birth. Booster doses like 1, booster 1, booster 2, it will be mentioned. So again at 5 to 6 years, one more DPT. Then at 10 to 16 years. So 10 to 16 years again we will be giving the DT vaccine. DT vaccine, that is for diphtheria and tetanus. Okay. So this is the easy way to remember. Pregnant women 2 shots, then at birth HBO, then OP pen IP rota PCV, then MRJE vita PCV, then booster time, one more DPT, and 10 to 16 years we will be giving this DT vaccine. Okay, so in the pregnant women we will be giving at least 3 years gap is there. We will be giving only booster dose, not 2 doses will be given, only booster dose will be given. So let me start with the MCQs now. So those who are online, don't forget to answer. So this is the first question. What is the dose of TT1 given to pregnant woman? So the first dose, how much it is given? Whether it is 1 ml or 0.1 ml or 0.5 ml or 2 ml. Those who are online, they can answer. Kritika Rajuvel, good morning, ma. So 1C. 1C is Velmurugan is on 1C. Then Dinesh Cattle Farm C. Okay. So while you are answering, don't forget to answer 1A, 1B, 1C or 1D. Okay. So almost Surekha JS C. Kritika. Okay. So the answer for this question is yes. So almost 1, 2, 3, 4, 5, 6 members. Okay, 6 members have given the answer right. Okay. Then we have second question. The TT booster dose is given if a woman has received TT within the last 1 year, 5 years, 3 years or 10 years. So tell me the second answer. Okay, Velmurugan is saying 2C, the TT booster dose is given if a woman has received TT within the last, yes. Good. Excuse me. So almost 2C has been answered by Vel Morgan, Dinesh, Sureka, Kritika Rajvel, and Deva Rati C. Okay. Yes, the answer is 3 years. Then third question. TT is given to children at 12 and 14 years, 6 and 10 years, 10 and 16 years, and 9 and 12 years. What can be the answer for this third question? It is given to children at 12 and 14, 6 and 10, 10 and 16, and 9 and 12 years. So for this third question. Okay, Deepika 2C is Well Murugan is saying 3C. Yes, okay. Pushpalata Pushpa 3 years, Well Murugan 3C. Okay. Yes, the answer for this third question is 3C. Good. Dinesh Cattle Farm 3C. Yes. TT is given to the children at 10 and 16 years. Then fourth question, which site is used for administering the BCG vaccine? So BCG vaccine manam A site lo istam. Right upper arm, left upper arm, left thigh, right thigh. Which site is used for administering the BCG vaccine? Fourth question. Pushpalata mention the question number also. Pushpalata Pushpa. Vel Morgan 4B. Good. Dinesh Cattle Farm 4B. Surekha JS 4B. Ritika Rajvel 4B. Yes, the answer for this fourth question is yes, 4B. Next, fifth question. OPV is given. OPV 0 dose. Here we are talking about OPV 0 dose is given at 6 weeks, at birth, at 9 months, and is given at 1 year. Mention the question number, Pushpa. OPV 0 is given at how many weeks? 6 weeks, at birth, at 9 months, or at 1 year. Well Murugan 5B, Dinesh Cattle Farm 5B, okay. Yes, 0 dose is given at birth. Very good. Daivarati Kritika Rajvel 5B. It is 5B is the. Then sixth question. The pentavalent vaccine is given at 9 months, 10 days, 6, 10 and 14 weeks, or 2, 4 and 6 months. So I already told you the pentavalent includes DPT, Hib, hepatitis B. That is diphtheria, pertussis, or whooping cough, tetanus, Haemophilus influenza B vaccine, hepatitis B vaccine. So what can be the answer for the sixth question? Vel Murugan 6C, Dinesh 6C, Kritika Rajvel, Surekha, and Daivarati 6C. Good, very good. So the answer is 6, 10 and 14 weeks. Okay, what is the dose of rotavirus vaccine? Rotavirus vaccine is mainly given for to prevent diarrhea in children. It is given through the oral route, right? So, how many? What is the dose? Whether it is 0.5 ml, it is 0.5, 2 drops, or 1 ml, or 5 drops. Is it is visible on screen? Good, Pushpa. 5B. So, you are answering good. Velmurugan 7D, Dinesh Cattle Farm 7D, okay. Kritika 7D, very good. Sureka 7D, yes. Next, eighth question. What is the site of hepatitis B dose injection? Whether it is left upper arm, right arm, anterolateral side of the mid thigh, or in the buttocks region. So, have you shared in your WhatsApp groups regarding this channel? Because our railway RRB exam will be having within 4 to 5 days. So, kindly be prepared. Almost, I think, on 29th, the exam there will be. 8C. Okay, Vale Morgan is saying 8C. Let me. Okay, good morning, everyone. So, already have channel the started the class at morning 6:30. So, I request all the members of this group to join the live channel. Okay, thank you, one and all. Okay, how many have answered? Yes. So, what is the dose of the hepatitis B vaccine? Okay, Velmurugan, Dinesh, Daivarati, Raj, Kritika, Pushpalata, 8C. Very good. That is 8C. Then, what is the minimum age for giving measles MR first dose? So, MR first dose is given at minimum at which month? Whether it is 6 months, 12 months, 9 months, or it is given at 2 years. What is the dose? 9. Velmurugan is saying 9B, okay. Dinesh 9C, Devarati 9B. 9B, yeah. Yes, it is given at the 9 months dose. Then the 10th question. What is the dose of DPT booster 1? Whether it is 0.1 ml or 0.5 ml or 1 ml or 2 drops. What is the dose of DPT booster 1? What is the dose of DPT booster 1? Tenth question is visible on screen. Okay, 10B, Dinesh, Velmurugan, Devarati, Sureka, yes. Kritika Rajvel, 10A. Yes, the answer for this 10th question is it is 0.5 ml. Surabhi 9B, okay. Pushpalata 9B. should be as answer 10B also. Okay. How many doses of vitamin A are given till the 5 years of age? So starting from the 9 months to till 5 years, how many doses will be given? Initial dose is 2 lakh international units, then the later doses will be like 1 lakh international units. 11C, yes. So almost 9 doses will be given. C. Dinesh Velmurugan, Surekha, Daivarati, 11C, yes. Then next we'll go into the topic much more deeper. Okay. Let me talk about the vaccines. So in vaccines we have two terminologies. One is fully immunized and the other is completely immunized. So what is the difference between this fully immunized and completely immunized? Fully immunized means the vaccines which they will be taking till 1 year of age group are called as fully immunized. So birth vaccine 6, 10, 14 dose, 9 months dose is there now. So that comes under this fully immunized one. Completely immunized ante 2 years varaku. So 2 years varaku వాళ్ళు ఏదైతే డ్యూ వ్యాక్సిన్స్ వాట్ ఎవర్ ఇస్ దేర్ till 2 years of age, that is called as completely immunized child. So understood the difference between fully immunized and completely immunized. Fully immunized till 1 year the vaccines whatever there if they receive, then at 2 years of age group if they receive all the dose of vaccines without any due, that is called as the completely immunized child. Then usually the vaccines are stored at the temperature of 2 to 8 degrees Celsius. The vaccines are stored. Then looking at the open vial policy, the open vial policy, all the vaccines are stored at the 28 days after opening, except, so once the vaccine vial, once it is opened, will be using till 28 days. Okay, but there are few exceptions. Konni exceptions unnai, konni vaccines manam 28 days daaka vaadakodu, like measles, rota vaccine, BCG, COVID and Japanese encephalitis అనేవి ఇవి అరౌండ్ మనం 4 to 6 hours లోపల వాడేయాలి. ఎక్సెప్ట్ JE, all the rest of the vaccines should be used within 4 to 6 hours. If you look at the Japanese encephalitis vaccine, Japanese encephalitis should be used within 2 hours of opening. Okay, and rest of the other vaccines can be used till 28 days. Okay, the measles, rota, BCG and COVID vaccine, this should be used within 4 to 6 hours. This is about the open vial policy. Japanese encephalitis alone should be used within 2 hours. Then looking at the dilution, so how this BCG is diluted? BCG is diluted using the normal saline, 0.9% normal saline. If you look at the measles is diluted with distilled water. Measles is diluted with distilled water. If you look at the measles ki reflection em ostadi W. So M ki reflection is nothing but the shadow enti W. So measles is diluted with distilled water. Understood? BCG is diluted with the normal saline. Then Japanese encephalitis vaccine is diluted with phosphate buffer. So these are the diluents of this particular vaccines. Then vaccine vial monitor. So vaccine vial monitor is something when we want to know how it means where it should be used, how within how much time it can be used, like that. So vaccines which can be kept till 28 days, so that is written on the vial of the body or on the neck of the body. Usually it is written on the top or on the neck of the body. We will find within how much period it can be used. So vaccine which do not come under vaccine vial, it is written on the neck or on the cap of the vial. So this will also help us to know regarding the total heat exposure of the vaccine. సో వన్స్ మనం ఓపెన్ చేసిన తర్వాత దానిపైన ఆ కలర్ ఉంటుంది చూడండి, ఆ క్యాప్ పైన మనకి ఇది కనిపిస్తుంది. సో దీనివల్ల మనకి ఏం తెలుస్తుందంటే టోటల్ హీట్ ఎక్స్పోజర్ ఆఫ్ ద వ్యాక్సిన్ ఉంటుంది. సో ఆ స్క్వేర్ కలర్ ఏదైతే ఉంటుందో దాన్ని బట్టి వీ విల్ డిసైడ్. సో ఇఫ్ యూ లుక్ ఎట్ ద square, if you look at the square color, if the square is completely invisible, there we have to stop using it. If the inner circle is lighter in color, at this 2 point it can be used, vaccine can be used. If the inner box is not visible or it has become dark in color, then after this 2 point we are not supposed to use that vaccine while monitor. It will help us to know the how much time it has been exposed to the heat. Okay, total exposure to the heat, and it is very useful after you are looking at the neck of that particular vial or on the top of the vial. It is clearly visible. The square will help us to know whether that particular vaccine has to be used or not. So this is the starting point, how it looks like. So this can be used and this cannot be used and this cannot be used. Like, see the inner ring which is not at all visible, here it has become completely dark. Only at this point the vaccine can be used. So this is regarding the vaccine. Next we will start off the biomedical waste. So if you look at the biomedical waste management comes under Ministry of Health and Family Welfare. So biomedical waste comes under Ministry of Health and Family Welfare. It does not come under this the like forest department. It does not come under the forest department. It comes under Ministry of Health and Family Welfare. And this BMW, it was amended in the year 2016. The laws have been come since 2016. It has been followed. So coming to the types of biomedical waste which we are using in the hospital side. So there are 4 types of colors which we will be segregating and discarding the waste. ఏంటంటే ఆ color, first one is yellow, then the second one is red, then the third one is blue, fourth one is white. Okay, if you look not white, it is black color actually. So if you look at the yellow color lo మనం ఏమేం వేస్తాం, infection waste or incinerable waste. Incinerable waste అంటే where we will burn it. So in the incinerable waste it is burned. So infectious waste, incinerable waste, everything will go into the yellow category. Then coming to the red category, మనకి రెడ్ లో ఏమేమి వస్తుంది, రెడ్ లో we will get this rubber. Okay, so rubber, plastic and tubes, everything comes under the red color waste, that is recycle. Then it will be sent back to the manufacturer. So rubber, plastic, tubes comes under this red. So red కింద మనం ఏమేమి వాడతాము, like plastic waste, like catheters, OG tubes, Riles tube, then central line, PIC line, then plastic, anything that comes under plastic lo ఏమైనా వస్తే everything will go into the red color one. Then coming to the blue is again been categorized into category A and category B. Category A means all the glass waste in come under this category A color waste in blue. Category blue we have B. So category A and category B we have blue. In that ortho body implants and recyclable. So these ortho body implants will be sent for recycling. Okay, so బ్లూలో మనకి కేటగిరీ ఏ ఉంది, కేటగిరీ బి ఉంది. ఏలో వచ్చేసి మనకి గ్లాస్ వస్తుంది, బిలో వచ్చేసి మనకి బాడీ ఇంప్లాంట్స్ అన్నీ వస్తాయి. దెన్ కమింగ్ టు దిస్ వైట్ వన్, ఇన్ ద వైట్ వన్ వీ విల్ హ్యావ్ షార్ప్స్ లైక్ ఎల్పీ నీడిల్. సో వైట్ పీపీసీ కంటైనర్ ఇస్ దేర్, నో ఇన్ పీపీసీ కంటైనర్ వీ విల్ బి డిస్కార్డింగ్ షార్ప్స్ లైక్ ఎల్పీ నీడిల్. Like LP needle, trocars, mutilated and shredded. Mutilated and shredded means the small parts will come into this white one. So this is about the yellow color. If you go deeply into this yellow color waste, again this yellow color waste, if you look into it, that is around human waste, animal waste, body parts like human organs, like human organs, placenta, fetus, body parts, amputated organs, all this comes under this yellow color waste. Then soiled waste is after doing dressing, ఎస్పెషల్లీ దిస్ ఆర్థో కేసెస్ ఉంటాయి కదా, ఆర్థో కేసెస్కి డ్రెస్సింగ్ చేసిన తర్వాత, లేకపోతే నార్మల్ పేషెంట్స్కి ఏదైనా వూండ్ డ్రెస్సింగ్ చేసిన తర్వాత గాస్ ప్యాడ్స్, ప్లాస్టర్ కాస్ట్ కూడా మనకి ఈ ఎల్లో కలర్ వేస్ట్ కిందే వస్తుంది. దెన్ డిస్కార్డెడ్ మెడిసిన్ కమ్స్ అండర్ సైటోటాక్సిక్ వేస్ట్ ఇట్ లుక్స్ లైక్ in triangle shape with C written on it. Okay, discarded medicines mean expired మెడికేషన్స్ ఏదైతే ఉందో అది మనకి సైటోటాక్సిక్ వేస్ట్ కింద వస్తుంది. నెక్స్ట్ కెమికల్ లిక్విడ్ వేస్ట్ మీన్స్ see in the hospital side there will be few liquid chemicals which we will be using, right? That will also I will show. All these things comes under category E, category F. Then category G means linen bed masking gown, used masks, used linen means the torn one, ante chinipoyinvi which cannot be reused, those things of waste will come into this yellow. Then microbiology, biotechnology, lab waste. So all these things comes under this yellow waste. So discarded medicine will come under yellow with the cytotoxic label under over it. So hospital waste, that is biomedical waste and cytotoxic waste. So in the cytotoxic waste, I have told you we will be discarding the medicines, that is the expired medications will come under this cytotoxic waste with a triangle and C logo over it. Ma'am, used LUCD discarded in which one? Dinesh Farm Cattle. What is the full form of this LUCD? Then solid and liquid type of waste. Liquid type మనకి ఎల్లోలో ఏమేమి జనరేట్ అవుతాయి, లైక్ ద ఎక్స్ట్రా ఫిలిం బీయింగ్ డెవలప్డ్. దెన్ aspirated body fluids అంటే see like the synovial fluid or pleural fluid, whatever the fluids which are coming out of the body, this has to be pre-treated చేసిన తర్వాతే దీన్ని డిస్కార్డ్ చేస్తారు ఎల్లో వేస్ట్లో. దెన్ డిస్కార్డెడ్ డిస్ఇన్ఫెక్టెంట్స్, క్లీనింగ్ ఏజెంట్స్, ఇన్సెక్టిసైడ్స్. అట్ ద హాస్పిటల్ సైడ్ మనం ఏం చేస్తాం, మెడిసిన్ స్ప్రే చేస్తాము, లైక్ స్ప్రే చేసే మెడిసిన్స్, క్లీనింగ్ ఏజెంట్స్, ఇన్సెక్ట్స్ని చంపే ఇన్సెక్టిసైడ్స్, వీటిని అన్నిటిని ఫస్ట్ మనం న్యూట్రలైజ్ చేసిన తర్వాత ఇట్ విల్ బి డిస్పోజ్డ్ ఆఫ్. Directly it will not be discarded, it will be neutralized, then only it will be disposed. So all these things comes under chemical waste. Then fluid and liquid chemical waste comes under this. I have already told you IUCD, intrauterine copper device, intrauterine implants and all, it comes under blue, right? See here I have told you in blue category B we have already, category A and category B. So ortho, body implants, everything will come under blue. Okay, intrauterine copper device, I understood, it will come under category B in the blue color bin. Then so all the liquid chemical waste, the bedsheets, all these things will be pre-treatment and it will be discarded. Then coming to the urine is usually, it is yellow in color, but it will go into the red color biomedical waste. Whereas blood bags is red in color, it will go into the yellow color biomedical waste. Understood? Urine is yellow in color, it will go into red biomedical waste, and blood packets, used PRBC packets will go into the yellow color. So this is the opposite colors. So easy to remember, isn't it? Okay, Dinesh. If you look at just the images, so images can choose yellow color waste lo manaki placenta, body parts like dead fetus, then PRBC packets, then used gauze, dead animals, cytotoxic waste like the medicines, mask, shoe covers, and the body fluids. It will be pre-treated and it will be discarded into the yellow color waste. Then red. If you look at the red, I have already told you the catheter, Ryle's tube, nasogastric tube, urine bags, vacuotenus, then syringe, everything will go into the plastic pipettes, tubes, all these things will go into the red color waste. And usually common biomedical waste facility is there. So in the common biomedical waste facility, so if for red color there is no pre-treatment, only for yellow color we have pre-treatment, but rest of the things all will go into the common biomedical waste facility. So red color lo manaki em vastundi? So red color lo manaki plastic waste anta vastundi, like the gloves, IV sites, syringes, Euro bags, then vacuotenus, VTM containers like we will shift this RT-PCR things, no? This COVID swabs, VTM containers, then fluid bottles also, once it is finished we have to cut the fluid bottle, then we have to discard it in the red color bin. Then in yellow color, so sorry, not in yellow color, then in blue color body implants. So blue color we have glass, broken glass, ampoules, medicines, body implants, everything will go into this one blue color one. Here also no pre-treatment anedi undadu blue color. Okay, the broken ampoules, vials, everything will go into the common biomedical waste facility. Then the white PPC. So in the puncture proof container, the scalpel blades, used needles, then this pre-filled cartridges, once it gets locked, no, all these things will go into this one. Then suture needles, there's GRBS needles, suture needles, insulin syringes, everything will go into this white PPC container. So all the sharps, needles, syringes with fixed needles. So here also no pre-treatment is not required here, and it will directly go into the common biomedical waste facility where it will be mutilated and shredding is done. Then black. So in the black color waste, they will be going kitchen waste and newspapers, kitchen waste, disposable cups, everything, cups and plates will go into this black color waste. In the black color, this is generally we call, this is general waste. Okay. So understood? So in yellow we have infection and cytotoxic waste, and if you look at the size of the bag, will be 50 microns. This is a non-chlorinated bag and the size of the bag is 50 microns. Okay. Then in the red color it goes rubber, tubes, plastic, and here if you look at the size of the bag, this is more than 50 microns. So more than 50 microns untundi. This is a non-chlorinated bag, and I already told you urine bag will go into the red and blood bag will go into the yellow color waste. Then B type of blue color. In the blue color, the glass waste, puncture proof will go into the cardboard, and body implants will go into the category blue. Then white color, sharps, PPC, transparent, white bin, it will go into the white color one. Then coming to the mercury spill. So when there is a mercury spill in the hospital, what we are supposed to do when there is a mercury spill, you have to seal that particular area. You have to keep the signboard like there is a mercury spill in that area. You have to keep a signboard over there. Then you have to take the take two cardboards, and with the help of the two cardboards you have to pick up the mercury spill. Okay, if the mercury spill is like very small amount, ante chala chinnadi meeku, if it is not visible to your eyes, then what you will do, we will just switch off the lights and put a torch and you just examine that particular area. This particular mercury will be clearly visible in that light. Then you can use take a syringe and you have to extract it using the small particles. Take the syringe, extract it and put it into the yellow cover, and you have to label it. You have to label the mercury spill, and you have to discard this particular one. Understood? And if it is more in nature, means ఆ మెర్క్యూరీ స్పిల్ కానీ ఎక్కువ ఉంది అన్నప్పుడు మనం ఏం చేస్తామంటే, ఒకవేళ స్మాల్ పీసెస్ ఉందంటే విల్ బి యూసింగ్ జింక్ ఆర్ సల్ఫర్ పౌడర్ along with H2O we will use instead of syringe. Means syringe also is there. If small pieces are there, we will use the zinc and sulfur powder. It will be used along with H2O. Then we will put it into the using the paper towel, we will put it into the yellow category bag and we will label it as the mercury waste, Hg or mercury waste. Okay, put it into the yellow cover, and you label it as Hg waste. లార్జ్ స్పిల్ ఉంటే కార్డ్బోర్డ్స్ యూస్ చేస్తాం. స్మాల్ స్పిల్ ఉంటే మనం జింక్ ఆర్ సల్ఫర్ పౌడర్ యూస్ చేస్తాం. మరీ స్మాల్గా ఉంటే టార్చ్ లైట్ వేసి సిరెంజ్తో ఎక్స్ట్రాక్ట్ చేసి మనం దాన్ని ఎల్లో కవర్లో వేసి డిస్కార్డ్ చేస్తాం. Then coming to the COVID waste. So where the COVID waste will go? COVID waste ante especially this used PPE manaki COVID waste will go into the yellow color with the bag size will be more than 50 microns. Double layered 50 micron bag there will be. Okay, let me start with the 12th question of today's session. Okay, which vaccine must be used within 2 hours of reconstitution, whether it is BCG, Japanese encephalitis, measles or rotavirus? Those who are online, just kindly answer the question. Which vaccine must be used within 24 hours of reconstitution? That is BCG or JE or measles or rotavirus. Which one? 12B Surabhi SM, 12B Vail Murugan, 12B Kritika, 12B. Very good. Okay, Radhika Mudiraj is saying okay, the COVID waste will go into yellow. Okay, good. Yes. Yes, the Japanese encephalitis should be used within 2 hours. Rest of the vaccines, it can be used within 4 to 6 hours. Good. Then 13th question. Where is the vaccine vial monitor located for vaccines not covered under the open vial policy? Open vial policy meeda where it will be located? On the body of the vial, on the neck or cap of the vial, on the vaccine box or on the cold chain logbook? Where? Where the vaccine vial monitor located for vaccines? 13th question. On the body of the vial. Okay. 13B. Those who are 19 members, those who are watching online, don't forget to like the channel, share the channel, subscribe the channel. Just give a like. Okay. Radhika Modiraj, good information, madam. Thank you so much, Radhika. 13B, Surabhi Velmurugan, 13B, Kritika Rajwell, 13B. Yes. Yes, it is written on the where vaccine vial monitor manki VVM అనేది policy లేనప్పుడు. So once we don't have this VVM, it is written on the neck or cap of the vial. Okay. Next 14th question. What does a VVM indicate? Expiration date or total heat exposure to vaccine, vial usage count or freezing incidents? Which one? What does a vaccine vial monitor indicate? 14B. 14B, Surabhi SM, Nursing Pilla. Nursing Pilla ఎప్పుడు జాయిన్ అయ్యామా? ఓకే. Nursing Pilla 14B, Surabhi 14B, Tinu SB, Velmurugan 14B. Tinu S, put the question number. Yes. So it will help us to know the total exposure to the vaccine. So the 14th question is 14B. Good. Then we have 15th question. Which of the following is used as a diluent for the measles vaccine? So in the measles vaccine, what diluent is used? Normal saline, distilled water, sterile saline or phosphate buffer? Which one? Okay, okay, నా సింపుల్ నైట్ డ్యూటీలో ఉన్నావా? ఓకే, నాకు కూడా ఇప్పుడు 9 o'clock డ్యూటీ ఉంది. Okay, 15th question. Okay, many members have answered 15th question. Okay, let me take a screenshot and put it in the group. So these are the members who have answered the 15th question. Velmurugan, Kritika, Surabhi, Dinesh, Topper, Tinu, Kaji, Anush, Arusha, Tinu SB. Okay. Yes. So measles is diluted with the distilled water. Normal saline is for BCG vaccine. Phosphate buffer is for Japanese encephalitis vaccine. Then we have 16th question now. Okay. Which ministry oversees biomedical waste facility management in India? Ministry of Health and Family Welfare, Ministry of Environment, Forest and Climate Change, Ministry of Rural Development or Ministry of Urban Affairs? So which one is the option? రాధికా మున్రాజ్, ఎవ్రీ లైవ్ ఎపిసోడ్ ఎప్పుడు స్టార్ట్ అవుతుంది మేడం? నేను క్లాసెస్ తీసే ముందు నా వాట్సాప్ గ్రూప్లోనే అప్లోడ్ చేస్తాను. అంటే నేను కూడా వర్కింగ్ పర్సన్ కాబట్టి నాకు టైం దొరకదు. సో ఎప్పుడైతే క్లాసెస్ ప్లాన్ చేస్తున్నానో 2 to 3 days ముందు నేను నా వాట్సాప్ గ్రూప్లో అప్లోడ్ చేసేస్తాను. దట్ టుమారో ఐ విల్ బి టేకింగ్ సెషన్ అని చెప్పేసి. ఒకవేళ మీరు నా వాట్సాప్ ఛానల్ జాయిన్ అవ్వాలనుకుంటే నా డిస్క్రిప్షన్ బాక్స్లో లింక్ ఉంది, జాయిన్ అయిపోండి. నా వాట్సాప్ గ్రూప్ యాజ్ వెల్ యాజ్ నా టెలిగ్రామ్ ఛానల్లో కూడా అప్లోడ్ చేస్తాను. ఎందుకంటే నోట్స్ ఏదైతే ఉందో టెలిగ్రామ్లో అప్లోడ్ అవుతుంది. సో అక్కడ మీకు కూడా తెలుస్తుంది దట్ ఐఎమ్ ఆన్ సో అండ్ సో డేట్ దట్ ఐ విల్ బి టేకింగ్ ద క్లాస్. ఓకే. So, 16th question, Ministry of Health and Family Welfare, Nursing Pilla, Kritika, Velmurugan, Surabhi, Daivarati, Arusha, Topper, Tinu, put the question number. Yes, that is 16. Sorry, I have labeled it wrongly. It is Ministry of Health and Family Welfare. Okay. Then we have 17th question. As per the 2016 amendment, what category does discarded disinfectants fall under in biomedical waste? So discarded disinfectants మనకి దేని కింద వస్తాయి? Category B sharp waste, category F liquid chemical waste, category C infectious waste or category G glass waste? 17th question. 17C infectious waste. Okay. Okay, 17C, 17F option కూడా ఇచ్చానా? Okay, you're saying answer as category F. Okay, very good. Surabhi is saying 17, some 17B. Good. Okay. Why you're saying infectious waste, discarded disinfectants? Yeah, I'm talking about disinfectants here. Oh, many are confused. Discarded disinfectants. So the answer for the 17th question is, so it is category F. So 17th question, the answer is 17B, category B. Okay. So 1 second. So today I have posted one question regarding the so 1 second, let me take the screenshot. Okay, I have posted one question in the comment box. How confident are you with the immunization schedule? So most of you have told need a quick revision. So 40% of people are confident, 60% are asking for quick revision. So today we have completed the quick revision. I think now most of you are thorough with the biomedical waste and also with the immunization schedule, which is easy to learn. So with this we wind up the session. Any more suggestions in the comment box are welcome. Just want to listen from you. Okay. With this, we wind off the session. Thank you, one and all. Is it visible on screen? Want to listen from you? Okay. ఇదేంటమ్మా స్క్రీన్ పైన కనిపించట్లేదా? Okay. I don't know why it is not visible on screen, but I have typed something here. Okay. Thank you so much, Vail Morgan. Arusha, thank you. Radhika, thank you. Surabhi, thank you. Dev, thank you. Next class when, madam? Next class, Tinu, I will post in my WhatsApp group. Join my channel. So you will come to know. If you join my channel, you will come to know. Okay? With this, I finish it off.